Hey guys, welcome back. So in this particular session, we will be talking about several acts over here, and basically it is related to the Factories Act, ESIC Act and the Maternity Act, right? So basically, at the end, right, one day you shall be working in some, hospital, or you shall be working in some establishment, right? So over there, you should know about the laws, which is, which are already there from the government side. So we shall be knowing about it. So it's always good to know about that, so that what are the rights of an employee, right? And yeah, certainly one day you shall be hosting one establishment as well, for an example, an hospital, right? Okay, so in this particular session, I will be dedicating this session to Family Act, Maternity Act and the ESIC Act, right? ESIC Act, yeah, that is very bigger, humongous act over here. This is the logo for the ESIC, which you can see over here as well, right? This is the logo for the ESIC, guys, right? ESIC, yeah. You might have seen the advertisement in the in your televisions and all, that ESIC Chinta Se Mukti, right? That was the theme for the ESIC. So this is the logo for the ESIC, which you shall remember, right? However, we shall be talking about the ESIC after a few moments, right? But first of all, let me start with the Factories Act, right? So I hope you guys are ready. So let's dive into it. So very first one, which we shall talk about over here, that is the Factories Act, guys, right? Factories Act. Factories Act, actually they were introduced in which year, guys? That is the 1948. Okay. Basically, in the Factories Act, what we are studying is that it is actually it defines that which particular establishment will be called as factory. So every establishment cannot be called as factory. So what is the criteria? Actually, Factories Act 1948, they describe the criteria that this particular establishment can be called as factory, or this particular establishment might not be called as factory, right? So if that establishment will be called as factory, only then the rules of the factory will be implemented over there. If some establishment is not a factory, right, then the rules will not be implemented over there. That is very obvious, right? So factory says that, guys, it defines as an, it defines the factory, it defines factory as an establishment, right? As an establishment which is employing now, right? Which is employing more than or equal to 10 workers, which in that establishment where the power is there, right? So the establishment where the power is used, right? You shall be having the two establishments over here, right? One establishment is this and another one is this. This establishment is actually, this is using the power, this is using the electricity and all, right? And having more than 10 workers, or more than that, then this establishment will be called as a factory. And this establishment, let's say it is not using the power, but over here the criteria would be that this establishment should be having 20 employees, right, or more than that. So establishment which is using the power, establishment which is not using the power. Establishment which is using the power should be having at least 10 employees or more than that to consider that as factory under the Factories Act. And this particular organization or this particular establishment where the power is not used, here we will be saying that if the 20 or more than 20 employees are working over there in this particular establishment or organization, only then we shall be considering it as a factory, right? And once it will be considering as a factory, then we shall be talking about that what are the rules and regulations one factory should be following, right? Okay, so now once you have understood that, so employing, what criteria I told you? In the first criteria I told you that the more than or equal to 10 workers where power is used, right? Where power is used. Okay, and in the second category I said that more than or equal to 20 workers where power is not used. Okay, so first criteria we should understand that what is the factory, which establishment will be called as factory, or which organization will be called as factory. Once we understood that, now we shall be talking about what are the provisions, right? So let's study about the provisions. Under the Factory Act, right? So here they told us that, let's talk about the children first of all, and then we shall be talking about the adults, right? So in the children category, right? So I'm talking about the children realm right now, right? They they told that children who are less than 14 years, they will not be employed. They must not be employed, right? Otherwise, there will be the penalty whichever organization is employing them, right? So, children less than 14 years are prohibited from work. Prohibited from work. Okay. So, no organization or no establishment, no factory should be allowing the children less than 14 years to work in the establishment. Otherwise, there would be penalty on such organizations, right? First rule. Second thing is adolescent. Let me come over to the adolescents over here. Adolescents, I mean which age group I'm talking about? Almost around 15 to 18, 19 years, right? So adolescent 15 to 19 years, let's say, right? For those, they shall be working. They shall be working in the establishment, providing that the establishment or the organization, which is the factory over here, they should be providing the proper environment for the work. They should make sure that there is no night duty, right? So these kind of things might be there. So if adolescents are employed, right, so they can be employed under such circumstances, right? They shall be employed. They can be employed only in certain situations, guys, right? Only in certain situation. It doesn't mean that only certain. It doesn't mean that you are, you are telling them to do the night duties and all, right? That is not allowed for the adolescent age group. I'm telling. For the adult age group, yes, that can be allowed. But for the elderly age group, less than 19 years, less than 18 years, you shall not be asking them to do the night duty for your work, right? That is the thing. Second thing, they told us that they shall be working. They can work only between 6 a.m. to 7 p.m. right? But not in the night duties, right? Third thing over here, they shall not be working more than 4.5 hours, more than 4.5 hours work. So more than 4.5 hours work, right, is not allowed. Not allowed, right? Right. So in a day, more than 4 in a day, I'm writing over here. So more than 4.5 hours work allowed in a day, not more than that, right? Not more than that. So that is the important line over here. More than 4.5 hours, not more than that. Okay, so this is the sign where I'm writing like this. I'm making this sign, right? I'm making this sign over here. This is more than that, right? It is not. So not more than 4.5 hours over here. So be very clear with that. Okay. Next point over here, they should be allowed to leave. They should be allowed leave once every 15 days. Yes, once every 15 days and accumulated leave up to 40 days. Accumulated leave up to 40 days, right? So these are some scenarios which we need to remember about the adolescents, very frequently asked, right? Okay, so which of the following is not the law for the adolescent, or which of the following can be the thing, can be considered under the adolescent rule? So that can be asked in your MCQ, right? Okay. Next thing over here, what about adults, right? Once we have talked about the children, once we have talked about the adults, now we shall be talking about the adults now, right? Okay, so now let's talk about the adults, guys. Okay. In case of adults, what about the maximum hours of work, right? Yes, so it doesn't mean that if the person is adult, so in that case you shall be taking a lot of work from them. It's not that. There is a limit in the Factories Act, right? So what is the limit is that what is the maximum hours of work? Very frequently asked question. Maximum hours of work allowed in a factory or in an institution over here, what is that? So they said that not more than 48 hours per week, right? They said that not more than 48 hours per week, right? Okay, it might be extended in some cases to more than or equal to not more than 9 hours per day, right? So for the adults, guys, if we talk about the number of maximum hours which are allowed, actually, that is not more than 9 hours a day or not more than 48 hours a week. If we talk about the overtime, right, you must have heard about that, in companies, right, in the institutions, in the factories, right, the employees are doing the overnight as well, right? And for the overnight, first thing is they should be getting the allowance for that. They should be getting the pay for that, the separate wage for that, which is not included in their normal salaries, right? So they will be getting the wage for that. Second thing over here is there is a limit for the overtime also. So maximum on a stretch, if you talk about that, if you will be including the normal work and the overnight work also, overnight time also, that should not be overcoming 60 hours in a week, right? So over here they said that if you talk about the overtime, if a person is doing the overtime, then it should not be allowed more than or equal to more than 60 hours per week. So not more than 60 hours per week, that is maximum limit for the overtime as well, right? So these are two very important questions which we need to remember. Okay, next one which we shall talk about, that is what about the per capita space availability in a factory, right? So guys, please remember, if we talk about the per capita space availability in a factory, right, that would be somewhat around 500 cubic feet per person, right, per person, right? That is also the MCQ, guys. Next point over here which we shall remember, that is what about the safety and welfare measures, right? Very, very important question, guys. What about the safety and welfare measures, right? Safety and welfare measures. Okay, fine. If we talk about the safety and welfare measures, guys, now here we should we should be remembering the how many workers are actually working in some kind of factory, right? There are some factories which are the smaller factories comparatively. There are some factories which might be the bigger factories, right? There are some institutions which are very big. There are some institutions which might be small also, right? So there are different categories over here, right? So if we talk about if some organization or if some factory is having more than 1000 workers, right? So let's say that if some factory is having more than 1000 workers, right? In that case, one safety officer is must in that particular factory, right? So in that case, one safety worker should be there in that particular factory, right? If some factory is having more than 500 workers, in that case, one welfare officer should be there in that particular organization, right? So in that case, one welfare worker should be present in that particular organization or institution or factory, whatever it is, right? If we are saying the number of workers are more than 250, in that case, one canteen, one cafeteria should be there for the employees where they shall be having their food, right? So in that case, one cafe or one canteen should be there, right? So that the employees are taking their food and all. And if some factory or organization is there where more than 50 workers are working, in that case, one crèche should be present, right? One crèche should be present over there in that case. What is crèche actually? Where the babies and where the children might be playing, right? In that particular thing, you might be googling it, right? What is it? So there you will be playing there, it is like that thing where the babies might be having their right, like that. Okay, so these are some safety and welfare measures very commonly asked, guys. They will be asking you simply this much workers are actually working in some institution. What worker should be there at this particular level, right? So these kind of questions are coming very frequently, right? Now once we have talked about the Factory Act, now we shall be moving on to the Maternity Act, guys, right? So very simple, guys. Now let's talk about the Maternity Act. I hope everything is clear till now. Let's talk about the Maternity Act. Okay, now if we talk about the Maternity Act over here, then it is it was revised in year 2017, guys. It was revised in year 2017. Okay, now here in the Maternity Act, there are a lot of benefits which are given to the mother, right, during the pregnancy time or just after the delivery time, right? So at that point of time, we shall be talking about some points over here in the Maternity Act. First point over here is that here we are talking about the enhanced duration of the paid maternity leave. So previously the duration was less. Now during as per revised guidelines of the Maternity Act, which was released in 2017, they are talking about they have just enhanced the duration. They have just increased the duration of the paid maternity leave. So they enhanced the period of maternity leave, and this maternity leave is the paid maternity leave. It's not that any kind of organization, any kind of factory, right, where the employee is a pregnant female, right, they shall not be asking them to not pay, right? So here they, if some organization or factory is not giving the leave, that is also penalized, and according to this act. And if some organization is not ready to pay the salary to that pregnant female who is working over there, who is an employee of that particular company, that is also coming under the punishment, right? So that particular organization might be punished under this law. So that is the thing over here. So that's why paid maternity leave are right for the particular employed female, right? Okay guys, now next thing over here, if we talk about the working mothers, right? Now there could be different category of the females who might be working in some institution, right? It might be the government facility, it might be the private facility as well, it might be the government job, it might be the private job, right? So in every sector there are the females, in every sector there might be the pregnant females, right? So if they are getting the leave, the organization, the institutions, they must make sure that they are paying them as well their proper salaries, right? Okay, so this is the particular act. So it is coming under the Maternity Act over here, right? So if we are talking about the working mothers, right? If we are talking about the working mothers, right? They are saying that 12 to 26 weeks. 12 to 26 weeks is the time where they shall be taking the leave, right? And that will be the paid maternity leave. Second thing over here, which we shall talk about, if the working mothers are having the 2 surviving children, right? If the working mothers with 2 surviving children, in that case it is allowed till 12 weeks. In that case it is allowed till 12 weeks under the Maternity Act, right? If in some case some mother decided to adopt some kind of baby, some baby, right? So in that case, if the adopting mother is there, right? If adopting mothers, they shall be getting the leave for 12 weeks in that case as well, right? So 12 weeks from that date in which the child is being handed over to the family, or child is being handed over to the mother, right? So if there is a mother, the day on which she have adopted the baby, right, from that day she is eligible for getting this 12 weeks paid maternity leave. Okay, understood? So I hope there is no doubt about that. These 3 conditions you should be knowing them. These are coming under the Maternity Act, which was revised in the 2017. Now we shall be talking about our main act over here, that is the ESIC Act, and that is basically the Employees State Insurance Act. Yes, I'm very sure that everybody, whoever is watching this video, right, you must have heard about this ESIC. Doesn't matter in which part of this country you are living in, right? If you are an Indian citizen, you must have heard about this ESIC, right? So this is a very big organization, guys, right? So ESIC, we talk about what is the ESIC, that it is the employees, right? It is the Employees State Insurance Act, right? And it came in 1948, which was revised in 2019. Okay, so please do remember that. Now here, if we talk about, this ESIC Act is actually applicable to all the factories in India except few sectors, right? So this is actually applicable to all the factories, except few. And what are those? Let's talk about them. So they are not including the defense sector, they are not including the railways sector, they are not including the mining sector, right? So these are some sectors where the ESIC Act is not applicable. Otherwise, to all kind of factories, the ESIC Act 1948 is applicable, right? So now we shall be having some key features over here. So first key feature which I would like to mention over here is the first one which I'm mentioning over here, that is what about the finance contribution. So finance contribution by the ESI Act, right? So let's talk about that. If we talk about the finance contribution, guys, it is covering all the employees. It is covering all employees who are having the income of lesser than 21,000 rupees per month, right? So employees with income of lesser than 21,000 rupees per month. Okay, so this is a sign of rupee, as you can see over here. So very, very important, guys. They said that lesser than 21,000 rupees per month, right? If some person is having some disability, it has been loosened till 25,000 rupees per month, right? Okay, guys. Second point over here, two very important question comes sometimes, right? Very important question comes. They ask you, one is for employee and one is for employer. Who is employee? Employee who is going to the work, right? So if you are having an hospital, let's say, and I am going to work in your hospital, so I will be employee because I am gonna work in your hospital, and you will be employer because you are hiring me in your hospital, right? So you will be employer. So for the employee and the employer, so let's say employee, and in the second place I am writing the employer, right? Employer who is hiring the employee. So for both of them, they said that 0.75%, 0.75% of his or her daily wage will be included in this particular, how they will be beneficiary for this particular act. So if I am working as an employee in your hospital, so you will be employer, I will be employer. So I will be, you will be deducting some part from my salary, right? So you will be deducting around 0.75% of this salary, and you will be actually giving 3.25%, right, of daily wage, and this will be included and this will be submitted, right? So particularly employer will be giving some, employer will be giving some, and so that the person will be coming under this act, and the person might be beneficial for this particular act, right? What about the medical benefit, right? What about the medical benefit over here? So if we talk about the medical benefit, right, medical benefit, so here they are saying that 1/8 will be given by the state government. 1/8 will be given by the state government. Very important question, guys. And 7/8 will be given by 7/8 part will be given by ESIC, that is the Employee State Insurance Corporation, right? So that will be given by that. Yes, it has been asked twice, so please do remember that usually we might be confusing that with that 1/8 will be given by whom and 7/8 will be given by whom. So be very clear. 7/8 will be given by the ESIC, 1/8 will be given by the state government. Employee will be providing 0.75% of the daily wage, and employer will be providing the 3.25% of the daily wage, right? Okay, guys, fine. Now if we talk about the next thing over here, other benefits, right? So we have talked about the finance, we have talked about the medical benefits. Other benefit, what could be the other benefits over here? Now benefits can be given to the employees, the benefits can be given to the employers, right? So let's talk about them as well. So let's talk about the other kind of benefits, right, from this act, right, from this act. So first benefit which we shall be talking about over here, that is the medical benefit, right? That is the medical benefit, right? One thing I told you that yes, that 1/8 will be given by the state government and 7/8 will be given by the ESIC over here. But in case of sickness, usually in case of any kind of disease, if the employee got the disease, so if there is an employment injury or there is some employment disease, right? So full medical care will be provided free of cost, right? Full medical care will be provided free of cost. So in case of employment injury, right? So if the employment is injured, right, in that case, full medical checkup will be provided free of cost. So free medical checkup will be provided. Free medical checkup, right? And it will be including everything. Full medical checkup will be provided, and that will be free of cost. Okay, fine. Now second one which we shall be talking about over here, second benefit over here, that is the sickness benefit. That is the sickness benefit. So in the medical benefit, I told you that if the employment is getting injury, right? And here I am telling you that if the employee is sick, right, due to some kind of disease, let's say. So here they are saying that they will be given, these employees, such employees will be given 70% of daily wages, 70% of average daily wages. So given at 70% of average daily wages, right? And they will be given these wages for how many days, guys? For 91 days, right? And that has been asked previously. Okay, in how much duration of monthly I am talking about? So in 1 year. So in 1 year for 91 days, in 1 year for 91 days, 70% of the average daily wages might be given to that person, right? But for claiming this benefit, please remember, but if the person, for claiming this benefit, if the person wants to claim this benefit, in that case there is a condition, right, from the ESIC Act. So they are saying that the worker should be requiring to complete the 78 days of work within 6 months period of time, right? So the worker, right, required to contribute for how many days? 78 days, right, in period of 6 months, right, in period of 6 months. Okay, now once you talked about the sickness benefit, here we shall be talking about two more important terms over here. These are the sub terms which we shall say, or subtopics of this sickness benefit. So one term which we shall talk about over here, that is, what is the extended sickness benefit? Extended sickness benefit. And other one which we shall talk about, that would be the enhanced sickness benefit, right? So if we talk about the extended sickness benefit, guys, here they are saying that 80% of the daily wage will be given for 2 years. Daily wage for 2 years will be given for about 34 diseases. 34 diseases. Now there is very long list, right? Some of the diseases, for example, it could be the tuberculosis, it could be the leprosy, right? It could be the glaucoma, it could be the myasthenia gravis, right? It could be the coronary artery disease, and so on and so forth, right? So these kind of diseases will be covered under this act, and 80% of the daily wage shall be given for these chronic illnesses for about 2 years, right? For such 34 diseases which are given in that particular list, right? These are some of them which I have listed over here, right? What about the enhanced, right? So what will be the question, guys, about the extended sickness benefit? They will be talking about, you need to remember this number, that is 34 diseases. You should be remembering how much time period, that is 2 years, and you should be remembering how much of the daily wage, that is the 80% of the daily wage, will be given, right? So the next subtopic in the sickness benefit we shall be talking about, that is the enhanced sickness benefit. Enhanced sickness benefit. In the enhanced sickness benefit, guys, they are saying that, they are talking about the full wage will be given to those who are adopting the sterilization techniques, right? So this is for the sterilization technique. So it's a new technique over here. So a new benefit which is given from the government side, given from the ESIC side over here. So what is that? The full wages, right? So full wages will be given for sterilization techniques, right? Yes, what is the sterilization? For males it is vasectomy, and for females it is tubectomy. So they are saying that, right, for duration of 7 days, right, the for duration of 7 days post vasectomy, right, post vasectomy, right, and for duration of 14 days, right, post tubectomy, right? So they will be eligible, they will be liable for getting the full wage even after these days, right? So female after tubectomy and the males after vasectomy, 7 days after the vasectomy and 14 days after the tubectomy, right? So full wages will be given for the sterilization techniques, which we need to remember over here. So very frequently they are asking us, what about the extended and what about the enhanced sickness benefit, right? So once we have talked about, now under this ESIC Act, let's talk about the maternity benefit. So this is for those females who are working in the corporation or working in the corporation related to the ESIC, right, or ESIC factory. Now, ESIC company or ESIC factory, right? Over here we shall be talking about, so let's talk about the maternity benefit, right? So let me write first. We will be talking about the maternity benefit. Guys, in the maternity benefit here they are saying that the benefit will be given, the benefit will be payable, that will be the full wages. So benefit will be given, okay, I am talking about full wages, right, full salary, full wages for how many weeks? 26 weeks. It will be given for 26 weeks or 6.5 months, right? 26 weeks or 6.5 months, right? For what? Pregnancy, right? So the pregnant female, if she will be keep on getting the maternity leave, she will be getting the paid maternity leave, and she will be given the full wages under this particular in the Maternity Benefit Act from the ESIC, right? And the time period will be in a month, if we talk about, that is around 6.5 months, right? It will be 6 weeks for those who had miscarriage. So 6 weeks following miscarriage, she will be getting the full wage again, right? And third thing over here, 30 days for sickness arising due to some pregnancy complication, right? Let's say there was some pregnancy complication, so 30 days after that. So 30 days for sickness due to pregnancy complications, right? So there are so many complications over there. So due to any complication, if the female is not well, so she will be getting the 30, she is eligible, she is liable for the 30 days paid maternity leave, obviously, right? Okay. So due to the complications of pregnancy, like that, right? Okay. Now, once we talked about the maternity benefit also, guys, now we shall be talking about some other benefits. For example, we have talked about the sickness benefit, we have talked about the maternity benefit, and we have talked about also the medical benefit. Now we shall be talking about the dependence benefit, right? So let's talk about the dependence benefit. So the next one which we shall talk about, that is the dependence benefit. Okay, in the dependence benefit, mainly in, let's say unfortunately some employee, right, some employee is dead, right? Let's say due to some due to some accident or something like that, some particular employee got expiry, right? So in that case, the dependent of that particular family, right, so they will be getting, they are liable for getting the 90% of the wages from that particular salary, from that salary of the person, right? And obviously this particular wage will be divided equally in those dependents, right? So over here I am saying that in case of death of a person who was working in this particular factory, working in this corporation, right, 90% of the wages will be given, is payable to the dependents, right? And this particular wages will be actually divided in the equal halves in the dependents of the family, right? Eligible son or daughter of this particular person is also eligible up to age of 18 years, right? So eligible son or daughter, right, is entitled up to age 18 years, right? Not more than that. And this benefit will be withdrawn if the daughter of that particular person, right, daughter will be getting married earlier, right? So the benefit will be withdrawn. Benefit will be withdrawn if daughter marries earlier, right? Because obviously we don't promote that. Daughter marries earlier, then this benefit will be withdrawn completely. Okay, so these salient features we should be remembering, right? So next feature, next benefit which we shall talk about over here, that is the disablement benefit, right? All these benefits are coming under which scheme? That is the ESIC Act, right, which was revised in 2019, right? Over here they are saying that if some person is disabled, right, there could be two disabilities. One could be the permanent disability, one could be the temporary disability. If the person is temporary disabled, right, if the person is temporarily disabled, then up to the disability, right, up to the disability, let's say this person had the accident and due to that he had the fracture in his or her leg, right. Now let's say for 1 month, or 2 months, doctor prescribed prescribing that complete bed rest should be given to this particular person, right. So for that period of time, they will be getting 90% of the wages from their salary, right. So they will be resting in their homes and they will be liable, they will be eligible for getting their 90% of wages. That is a temporary disability. If we talk about the permanent disability, the lifetime the person will be getting the pension for that. Okay, so temporary disability and temporary disability, and there is permanent disability, right, permanent disability. So temporary disability and the permanent disability. Over here what I said guys, temporary disability, for the permanent one, lifetime pension they will be getting, right. So no confusion in that, lifetime they will be getting the pension for that. So ESIC is having ESIC employees are having lot of benefits, right. So if we talk about the temporary disability, then 90% of the wages will be given. 90% of the wages shall be payable, will be given till disability, right, till disability. Obviously they will be needing the medical certificate where they will be, the doctor will be writing that yes, this person needs the medical rest, bed rest over there. So these kind of things, right. Okay, then what about the other benefit? So there is a funeral benefit also, funeral benefit, right, in which they are saying that 15,000 rupees, right, this is the maximum limit, maximum 15,000 rupees might be paid to the family for the funeral and all other procedures, right, all those procedures. So maximum 15,000 rupees, right, shall be payable to the family, for all the procedures, right, which are there related to the funeral processes and all, right. Okay, so that is also given. Now next one is the rehabilitation benefit or rehabilitation support, rehabilitation benefit, right. Now under this benefit, what we are talking about, rehabilitation benefit is talking about that insured person, right, who was actually the beneficiary of this one, right, and the family will be getting the medical treatment. They will be keep on getting the medical treatment even after their retirement, right. So if some person was employed in this particular factory, so over there, even after the retirement, they will be eligible for even after the retirement or even after the permanent disability, they will be eligible for getting the medical treatment, right. They will be continuing to get the medical treatment free of cost if they will be paying 10 rupees of payment, right. If they will be paying 10 rupees of payment every month, right. So in case of 10 rupees payment, right, if paying 10 rupees as a payment, right, if they are paying 10 rupees, then the medical treatment will be given free of cost to this particular person, right. Then the insured person and the family members continue to get the treatment, continue to get medical treatment even after their retirement, right. So that is a good scheme. So even after retirement, they just need to pay 10 rupees per month, right, even after retirement or permanent disability, right. So these are some benefit which I have talked about over here. Once they have asked us that which of the following is not the benefit covering under the ESIC, right. So you should be knowing the names of them as well. So we have talked about the rehabilitation benefit, we have talked about the funeral benefit, we have talked about the disablement benefit, right. Then we had to talk about the dependence benefit, we had also talked about the maternity benefit, we had already talked about the sickness benefit, where we had talked about two terms, extended and the enhanced sickness benefit. Enhanced sickness benefit was about the sterilization techniques, right, about the 7 days post vasectomy and 14 days post tubectomy, right. Then we had to talk about the sickness benefit, which was the part like extended and enhanced sickness benefit was a part of it, and then we had to talk about the medical benefit as well. So we have talked about the benefits which are given to the employee. Now we shall be talking about the benefits which are given to the employers, right? However, the important ones for the exams are the benefits which are given to the employees, right? So just for the completion sake, we shall be mentioning about the benefits which are given to the employers as well, right? So second one, the benefits which are given to the employers. So benefits to the employers I'm talking about, right? So let's talk about the benefits to employers. Employers. Okay, right. So benefits to employers, they might be getting the exemption from some things. For example, they might be getting the exemption from Workmen Corporation Act, right? They might be getting the Workman Compensation Act, right? Not the corporation, Workman Compensation Act, right? They might be getting the compensation from the Maternity Benefit Act, right? Exemption from Maternity Benefit Act, Maternity Benefit Act, right? They might be getting the income tax rebate, right? Income tax rebate, so they can save a lot of tax from here, right? But on that amount which they are spending towards the scheme, right? On amount which they are giving towards the schemes, right? So when you will be working in the hospital, right, and if your salary for an year, right, that will be exceeding in the given limit, right, for an example 5.5 lakhs or 5.5 lakhs, right, in that case they will be asking you to show some of the investment, right, in some schemes, right? For example, it could be the some government scheme, or it could be some other kind of thing where the tax rebate are available, right? So that many of the employees are doing their investment in these schemes also, and they will be getting the tax rebate as well, right? Okay, and about the healthy workforce. Okay, so these could be the benefits as far as the employers are concerned over here, right? So in this particular session, we had a talk about the Factories Act, Maternity Act, and the ESIC, that is the Employers State Insurance Corporation Act, right? So very, very important in this particular act are all of the three one, but most frequently they are asking us the questions from the ESIC Act. So thank you so much for joining this session. I will see you in the next one. Thank you.